Hi all, greetings from Admin Smile Dental Tutorials. In this video, we'll be discussing lasers in dentistry. Laser, as we all know, is light amplification by the stimulated emission of radiation. Here is the definition of lasers. It is a device which transforms light to chromatic radiation. And this chromatic radiation include three spectra like visible, infrared and UV region. And what is the peculiarity of this radiation is that all the waves in it is in phase and it is capable of mobilizing immense heat and power when focused on close range. Wichmann and Johnson, in an in vitro study using a high power infrared carbon dioxide laser, attempted to seal the apical foramina. This was the first reported laser in endodontics. What makes a laser light different from an ordinary light? Laser light moves straight forward with almost no spreading at all, unlike an ordinary light, and it is coherent light, remains as a single color, thin beam, high energy density. Features of laser. The three main features of laser includes the first one, collimation and coherency, second one, efficiency, third one, it is monochromatic. Contact and non-contact modes. Laser works by vaporization and coagulation in contact, non-contact and interstitial modes. Now we will see classification of lasers. Lasers are classified based on active medium, solid state laser, ruby and diag, erbium YAG, helium YAG laser, gas laser, excimer laser, dye laser, semiconductor laser. And based on application, soft tissue laser, hard tissue laser, resin curing laser. Based on level of energy transmission, low level energy, that is soft laser, high energy, that is hard laser. Based on level of clinical use, for diagnosis, for non-surgical treatment, for surgical treatment. And based on wavelength, these are like carbon dioxide, Nd:YAG, argon, excimer, helium YAG and erbium YAG laser. Then we will see the effects of lasers on hard tissue, oral soft tissue and pulp tissue. First one, effect of lasers on dental hard tissue. The hard tissue or the dental tissue may reflect the laser, or it may get absorbed, or it may get scattered into the tissue, or it can be get transmitted into the tissue. These are the different laser emission modes: continuous wave, gated mode, pulsed mode, super pulsed mode, ultra pulsed mode, chopped modes. Laser effects on dental pulp tissue. In a dental pulp tissue, odontoblasts and the erythrocytic matrix gets affected the most. When a laser wavelength of greater than approximately 390 nanometer is used, it is shown to possess heat-producing characteristics. Continuous wave carbon dioxide laser can produce varying degrees of pulpal necrosis and can also form new dentin when used in pulsed mode. If the pulp temperature are raised beyond a 5 degree level, odontoblastic layer may not be present. Odontoblastic alignment may be acutely disrupted. With the advent of super pulse laser system nowadays, a potential decrease in soft tissue necrosis became possible as sufficient time was available for heat dissipation. Now we'll see the effects of temperature on target tissue. In this table you can see the tissue temperature and the observed effect. The first one, 37 to 50 degree, there is hypothermia of the target tissue. When the temperature rises beyond 60 degree, there is coagulation and protein denaturation. And the temperature is in between 70 to 90, there can be welding of tissue, 100 to 150 vaporization and greater than 200 carbonization may occur. The last one, we will see the lasers on soft tissue. There are 4 different kinds of uses of lasers on soft tissue. The first one, welding of soft tissue. The second one, ablation and incision. The third one, sterilization and disinfection of tissue. And the fourth one, hemostasis. Now we'll see in detail ablation and incision. Excision is performed with a focused beam of 1 mm or less to cut or incise tissue in a manner similar to scalpel. Compared to electrocautery, laser wounds appear to cause less collateral damage but heals slowly, and the selection of laser depends upon the water content of the tissue to avoid excessive heating and charring of tissue. Now we'll see the hemostasis. The mechanism of hemostasis of using a laser. When we use a laser, the blood elements get heated up, which results in desiccation and contraction of vessel wall, then resulting in direct sealing of small blood vessels. We use carbon dioxide laser, Nd:Arg lasers and argon laser for the same. The next uses welding of soft tissue. At a temperature of 60 degree or greater, the triple helix of collagen in the tissue gets unfolded, which results in welding of soft tissue. Carbon dioxide, argon, Nd:Arg have been used to weld nerves, blood vessels, and skin. Factors related to heat generation by lasers. Laser parameters such as wavelength, mode, whether it is pulsed or continuous, power density of laser influence the heat generation, and also the characteristics, the absorption characteristics of exposed tissue also influence the heat generation, and of course the exposure time influence the heat generation by lasers. In this slide we will see the wavelength used in lasers. It ranges from the smallest argon laser to the carbon dioxide laser. Now we'll see all the lasers in detail. The first one, argon laser. It is in visible spectrum. 2 wavelengths used in dentistry. The first one is blue 488 nanometer and the other one is blue-green 514 nanometer. Here no need to protect the teeth during surgery due to poor absorption by hard tissue. Useful in soft tissue welding and soldering. Diode laser. Diode, as we all know, is a semiconductor. So here we use semiconductor crystals, combination of aluminium or indium with gallium and arsenic. When we use aluminium, wavelength is 800 nanometer and in indium, wavelength is 980 nanometer. It is poorly absorbed by the tooth structure and the chief advantage is smaller size, which makes them portable and compact units, and it is very economical. Neodymium-IAG lasers. The wavelength is 1064 nanometer. It is slightly absorbed by dental hard tissue, so soft tissue surgery adjacent to tooth is very safe and precise. And we can easily vaporize the pigmented surface carious lesion without removing the healthy surrounding enamel. It can be used in hemostasis and to produce pulpal analgesia, and also we can use it in treatment of aphthous ulcers. Neodymium-IAG laser is used for cutting and coagulation of dental soft tissue. The harmful effects are when used directly on bone and root surfaces. Erbium family. 2 lasers come under this family, erbium chromium YSGG and erbium-IAG. We can perform root canal and bone removal effectively by these lasers. Water spray is a must, transmitted by fibers. Can be used in contact and non-contact modes. Carbon dioxide laser. As we have discussed in the classification, it is a gas-active medium laser. The wavelength is 10,600 nanometer. It is used as a rapid soft tissue remover and has a shallow depth of tissue penetration, which is important when treating mucosal lesions. Useful for cutting dense fibrous tissue. The tissue ablation can be precise with careful technique. In this figure, you can see the early used carbon dioxide surgical laser and the recent one, portable handheld carbon dioxide laser system. Now we'll discuss the laser applications in the restorative dentistry and endodontics. Laser applications in restorative dentistry includes caries detection, caries prevention, caries removal, cavity preparation, dentin desensitization, enamel etching, pit and fissure sealants. Then the other applications in restorative dentistry includes gingival retraction during impression procedures, removal of dental filling materials, photopolymerization of resins. Laser applications in endodontics includes diagnosis, pulpotomy, removal of smear layer and debris, sterilization of root canal, GP softening, apical surgery, closure of apical foramina of root canals. Caries detection. Argon laser energy, laser autofluorescence, dye-enhanced laser fluorescence, optical coherence tomography, polarization sensitive optical coherence tomography, diagnodent. Now we'll see QLF, that is qualitative laser fluorescence. It works on the principle of fluorescence. Here argon laser is used. By fluorescence from visible light excitation on teeth, it helps in differentiation between caries enamel and the sound enamel. Diagnodent, which works on the principle of QLF. Diagnodent uses a 680 nanometer filter and it detects caries by measuring changes in fluorescence intensity. The spectral differences ranges from 0 to 30. 0 to 10 is interpreted as healthy tooth structure, 11 to 20 outer half enamel caries, 21 to 30 inner half enamel caries, 30 plus dental caries. Pipe diagnosis, laser Doppler fluorometry. LDF was developed to assess blood flow in microvascular systems. In this technique, using a helium neon laser emitting at 632.8 nanometer, we will irradiate the moving red cells. They get scattered and a fraction of light gets back scattered, and the Doppler detects it and processes to produce a signal which denotes the red cell flux. This information can be used as a measure of blood flow, the value being expressed as a percentage of full-scale difflection. The next use is caries prevention. How the laser is used to prevent the caries. The mechanism is by when we use a laser, the light in the laser is converted into heat as the laser is absorbed, resulting in increased resistance of tooth to demineralization, which means the tooth gets more resistant to caries. When we look mechanically, we know the tooth structure composed of calcium carbonate crystals. When a temperature greater than 400 degrees centigrade is used by laser, the carbonated hydroxyapatite on the surface and subsurface get heated up, decomposing the carbonate and leaving behind the hydroxyapatite-like mineral which is less resistant to demineralization. Carbon dioxide laser is used in pulse mode with pulses of 100 microseconds. It has been shown that enamel displays a significant reduction in acid solubility after argon lasing. The mechanism of increased fluoride uptake and caries resistance to enamel includes alteration in composition of mineral phases with loss of carbonate and water, as we have discussed. In the next one, microspaces in mineral structures which traps fluoride and calcium ion, thus increases the caries prevention. Increased uptake of fluoride, decreased permeability to acids due to protein denaturation and swelling. Then the next one, caries removal or cavity preparation. We can use lasers to prepare a cavity. Mainly we use erbium YAG lasers. Erbium uses the principle of hydrokinetics. Here, a rapid subsurface expansion of internally trapped water within the mineral substrate causes a massive explosion, and this explosion produces a popping sound which is known as photoacoustic effect. Dental hypersensitivity. Dentinal hypersensitivity, as we all know, is a sharp pain from exposed dentin that occurs in response to provoking stimuli such as cold, heat, evaporation, tactility, osmosis, or chemicals. Erosion, abrasion, adhesion, gingival recession, periodontal treatment, and anatomic defects are the risk factors. 1 in every 7 patients suffer from some degrees of dental hypersensitivity. The treatment modality by laser in the treatment of hypersensitivity is by 2 mechanisms. The first one, the direct effect of laser irradiation on the electric activity of nerve fibers within the dental pulp, and the second one is by the modification of tubular structure of dentin by melting and fusing of hard tissue or smear layer and subsequent sealing of dentinal tubules. When we use laser on dental hard tissue, the dentinal tubules get melted and fused to the hard tissue, which results in sealing of the dentinal tubules. Thus, the exposed dentinal tubules get sealed up, which results in decreased sensitivity, and this is used as a treatment modality by lasers for hypersensitivity. Then in hypersensitivity we use low output power lasers, helium neon and gallium aluminum arsenide like diode crystals. Then middle output power lasers, neodymium YAG lasers, carbon dioxide lasers. In this figure you can see how a dentinal tubule gets closed up or gets sealed up after laser irradiation. Carbon dioxide lasers are used in pulp capping and pulpotomy, heat stimulation by laser instead of hot gutta-percha, Nd:YAG laser, differential diagnosis of pulpitis by laser stimulation, laser ablation and accessory treatment for vital pulp amputation. Carbon dioxide laser usually is used at a power of 1 to 4 watt. 3% hydrogen peroxide and 5.25% sodium hypochlorite is used to remove charred tissue. Root canal wall preparation by lasers, erbium YAG laser at 8 Hz and 2 watt. Laser application for removing pulp remnants and debris at the apical foramen. The power of 2 watt at 20 pps for 1 second is recommended. A 5-second interval should be used if laser irradiation is performed 2 or 3 times. Smear layer removal. Carbon dioxide, Nd:YAG, argon, erbium, chromium YSGG and erbium YAG laser irradiation has the ability to remove debris and smear layer from the root canal walls following BMP. That is biomechanical instrumentation. Cleaning and shaping of the root canal. We all know the success and prognosis of root canal therapy depends upon the elimination of microorganisms from the root canal system. If the microorganisms are not eliminated properly, it will result in the failure of endodontic therapy. So, infected root canals are an indication of laser treatment. We use pulse Nd:YAG, argon, semiconductor diode, carbon dioxide, erbium YAG, and other lasers have been considered for use in this treatment. The most recommended one is pulsed Nd:YAG laser because of the ease with which The laser fiber can be controlled. Endodontic surgery. Laser can be used in endodontic surgery. When a non-surgical treatment does not give a better result, we go for surgical treatment. When we use laser in endodontic surgery, an eventual cap formation occurs due to the melting of cementum and dentin. Retrograde use of lasers, that is in endodontic periapical surgery. It improves hemostasis, thus we can see a better visualization of proper operative field, potential sterilization of the contaminated root apex, potential reduction of permeability of root surface dentin, reduction in post-operative pain, reduced risk of surgical site contamination by eliminating use of aerosol producing air turbine handpieces for apicectomy. Other clinical uses of lasers other than the restorative dentistry and the endodontics, we can use lasers in wound healing or post-surgery, TMJ disorders, hypersensitive dentin during extraction, orthodontics, herpes labialis, aphthous ulcer, mucositis, paresthesia, trigeminal neuralgia, acupuncture. In this slide, we can see the indication of different kinds of lasers. The first one, vitality test, we use helium neon diode lasers. For treatment of deep caries, we use carbon dioxide Nd:YAG lasers. And in the sterilization of root canals, we use Nd:YAG carbon dioxide holmium YAG lasers. Vital amputation, we use carbon dioxide Nd:YAG lasers. And root canal preparation, we use excimer Nd:YAG erbium YAG lasers. And for sealing of apical delta, we use carbon dioxide Nd:YAG lasers. And for thermoplastic root canal filling, we use carbon dioxide Nd:YAG lasers. Here we can see different kinds of laser system such as water laser, compo laser, Nd:YAG laser, and the last one, delight laser. That's all about lasers in dentistry. Thank you for watching the video. For more updates on dental tutorials and more advances in dentistry, subscribe to YouTube channel Admin Smile Dental Tutorial and follow on Instagram page Admin Smile.